This presentation examines air quality management in Bangladesh. We will review the current pollution status, key challenges, and evidence-based strategies to move toward cleaner air and healthier, more resilient cities. I am Mahir Shahriar, a civil engineer and water-air waste energy nexus researcher. Drawing on academic and field experience in Bangladesh, I will synthesize recent data and propose practical pathways for improving national air quality. Bangladesh faces a severe air pollution crisis. PM2.5 levels are among the world's highest and reach about 15.6 times the WHO guideline. This chart positions Bangladesh alongside other highly polluted countries, underscoring the urgency for action. Bangladesh has repeatedly ranked as the world's most polluted country, with average PM2.5 around 76.9 micrograms per cubic meter, over 15 times the WHO limit. These rankings highlight a chronic, not temporary environmental emergency. Regional studies of NO2 and aerosol optical depth show that South and East Asian countries, including Bangladesh, China, India, Pakistan, and Japan, share high pollution burdens. Understanding this regional context is vital for coordinated solutions. Evidence shows anthropogenic pollutants dominate air quality problems. Major causes include diesel vehicles, complex pollutant chemistry, rapid urbanization, dense populations, diverse sources, and rising energy demand. Solutions require cleaner technology, strong laws, and sustained public awareness. Dhaka is now the world's second most polluted city. Over 10 million residents breathe unhealthy air, losing more than 8 years of life expectancy. Every day, hundreds of tons of dust settle on the city while even more remain suspended in the air. Pollution trends are worsening. Between 2019 and 2020, PM2.5 rose by 13.1%. Current levels are about 75 to 78 micrograms per cubic meter, 5 times Bangladesh's own standard and roughly 15 times the WHO guideline, signaling inadequate control measures. Key pollution sources include poorly maintained vehicles, brick kilns, coal-fired power plants, construction activities, and biomass burning. Each sector emits particulate matter and toxic gases, indicating that comprehensive cross-sector regulation is essential. Source apportionment shows brick kilns contribute about 35% of primary air pollution, vehicles and surface dust, 25% each, and industries 10%. These proportions help prioritize interventions, with brick kilns and transport emerging as top targets. Around 8,000 brick kilns operate in Bangladesh, clustered in 5 districts around Dhaka, and producing roughly 15 billion bricks annually. Most use primitive technologies and peak in winter, coinciding with the season of worst air quality. Images from Ghazipur, Narayanganj, and Savar illustrate how traditional kilns degrade local air and working conditions. In contrast, modern mechanized facilities demonstrate cleaner, more efficient brick production pathways that Bangladesh can scale up. Technology data show fixed chimney kilns still dominate the market and emit the most pollution. Cleaner options such as zigzag, vertical shaft, and tunnel kilns have lower emissions but limited adoption. Policy incentives can accelerate this technological shift. Air pollution is also transboundary. Pollutants can travel 200 to 500 kilometers, with India, Nepal, and Bhutan contributing significantly through industrial activity and seasonal burning. Up to 40% of Bangladesh's pollution may originate outside its borders. Vehicular emissions form a growing crisis. Diesel vehicles and poorly maintained fleets emit NOx, black smoke, and particulates. In Dhaka, traffic congestion and road dust resuspension together account for a notable share of urban air pollution. Rapid construction of megaprojects, such as the Metro Rail, Dhaka Elevated Expressway, Padma Bridge Rail Link, and Rupur Power Plant, generates substantial dust and emissions. Integrating air quality safeguards into project planning is therefore critical. Additional infrastructure projects, including the Dhaka Airport Third Terminal, Madharbari Coal Power Plant, new flyovers, and the Chittagong Cox's Bazar Rail Link, further intensify construction-related pollution unless strict environmental management is enforced. Air quality in Bangladesh shows strong seasonal variation. Winter has the highest pollution due to low temperatures, little rain, and inversion layers. Monsoon rains provide natural cleansing, while pre- and post-monsoon periods show elevated but varying levels. This graph of Dhaka's PM2.5 levels confirms the seasonal cycle. Concentrations peak in winter, drop sharply during monsoon, then rise again toward year-end. At all times, however, levels remain well above the WHO guideline, demanding year-round control. Health impacts are profound. Air pollution causes over 100 deaths per 100,000 people and has raised mortality by about 9% over 2 decades. On average, Bangladeshis lose 7 years of life expectancy, with Dhaka residents losing more than 7.5 years. This slide outlines the major disease categories linked to air pollution: cardiovascular and chronic respiratory diseases, respiratory infections, maternal and neonatal conditions, and diabetes with kidney disease together account for a large share of premature deaths, underscoring air pollution as a cross-cutting public health crisis. Here we see annual deaths from specific diseases attributable to air pollution: ischemic heart disease and stroke lead, followed by COPD, lower respiratory infections, and lung cancer. These figures highlight that cleaner air policies directly translate into fewer hospitalizations and lives saved each year. Certain groups are far more vulnerable to polluted air. Young children, pregnant women, older adults, and outdoor workers face higher exposure or weaker defenses. Protecting these groups requires targeted measures, such as safer work practices, health surveillance, and focused community awareness. Air pollution is not only a health issue, it is a major economic burden. In 2013, 6.14% of total GDP was lost, with productivity losses alone accounting for 3.4%. Nationally, this equals $6.52 billion, including $1.44 billion in Dhaka, demonstrating the scale of avoidable economic damage. This pie chart breaks down the economic impact of air pollution. Healthcare costs are the largest component, followed by productivity losses and infrastructure damage. Reducing emissions therefore offers a triple dividend: lower medical spending, higher worker productivity, and less damage to buildings and assets. Healthcare costs are rising sharply. In 2019, average per capita health expenditure reached 8,134 BDT, with the poor bearing the greatest burden. As pollution-related illness grows, so does this financial strain, reinforcing the need for preventive environmental action rather than reactive treatment. Environmental degradation from air pollution affects agriculture, seasons, plants, and even rainfall chemistry. Ground-level ozone reduces crop yields, dust disrupts pollination, and pollutants contribute to acid rain. These processes threaten food security, biodiversity, and long-term ecosystem stability. Over the past 2 decades, Bangladesh has introduced several key air quality policies. Milestones include removing lead from gasoline, banning two-stroke rickshaws, revising vehicle standards, launching the CASE project, shutting illegal brick kilns, and planning concrete block use. However, some measures remain pending. This slide highlights successful policy interventions. Phasing out leaded gasoline removed a major neurotoxin. Banning two-stroke rickshaws cut PM2.5 in Dhaka by 41%. Closing illegal brick kilns around the city further reduced emissions. These examples prove that decisive regulation can rapidly improve air quality. Bangladesh's air quality monitoring system, established under the CASE project in 2000, now covers 8 major cities with daily AQI calculations. This network provides essential data for tracking pollution trends, informing policy decisions, and communicating health risks to the public in a timely manner. Despite progress, implementation challenges persist. Regulatory gaps include a pending Clean Air Act and weak penalties, while institutional issues involve limited capacity, poor coordination, and inadequate monitoring infrastructure. Addressing these weaknesses is critical for turning policy intent into real-world outcomes. A comprehensive solution framework spans 4 pillars. Transport measures promote cleaner vehicles and stricter testing. Industrial actions modernize brick kilns and enforce emission controls. Green energy shifts us toward renewables, while construction regulations manage dust and materials. Together, these strategies can cut urban pollution. Economic policy tools can accelerate clean transitions. A carbon tax prices emissions, encouraging low-carbon choices. Reducing import duties makes hybrid and electric vehicles more affordable. Targeted technology subsidies support cleaner brick kiln upgrades, enabling industry to modernize without losing competitiveness. Strengthened monitoring is essential for accountability. An emissions database tracks sources and trends. Strict monitoring of key pollutants through multiple stations provides real-time data. Robust enforcement mechanisms backed by clear penalties and regular inspections ensure that standards are not merely symbolic. Effective air quality management requires a multi-stakeholder approach. Political leaders set direction and allocate resources. Scientists provide evidence and solutions. Healthcare professionals assess health impacts and advocate for patients. The private sector develops clean technologies and adopts responsible production practices. Because 40% of pollution is transboundary, regional cooperation is vital. 4 neighboring countries must coordinate monitoring, share emission reduction targets, and exchange technology. With pollutants traveling up to 500 kilometers, joint policies and data sharing are necessary to achieve lasting air quality gains. Clean technology adoption focuses on both bricks and vehicles. Advanced tunnel, zigzag, and vertical shaft kilns significantly cut particulate emissions. On the transport side, electric, CNG, LPG, and hybrid vehicles reduce tailpipe pollution, especially when supported by adequate charging and fueling infrastructure. Industrial controls and renewable energy solutions further reduce emissions. Continuous emission monitoring, scrubbers, and particulate collectors limit factory pollution, while process optimization improves efficiency. Solar, wind, biomass, and energy efficiency measures diversify the energy mix and lower dependence on fossil fuels. Key success indicators help track progress. Air quality metrics such as PM2.5 and AQI must improve. Health outcomes should show fewer respiratory diseases and longer life expectancy. Economic indicators include reduced GDP loss, while technology metrics capture adoption of clean kilns, EVs, and emission controls. In conclusion, cleaner air is both an environmental necessity and an economic imperative. Implementing strong laws, financing clean technologies, enhancing monitoring, and fostering cooperation will enable an eco-smart, climate-resilient future that safeguards health, supports growth, and protects generations to come.